So for today's agenda, we will be going over our objectives for today's webinar. We do have a small group activity in the beginning, and then we will dive into our main presentations because we have two presentations, one on individual resilience and the other one on community resilience. And then we will go into our main activity, which is going to be a breakout room discussion. And then we will also have a session for folks to share out what they discussed in our breakout room activity. And then we'll wrap it up with our polls. So that's going to be our agenda for today's webinar. So who is Envision? And I know a lot of folks are probably aware of who Envision is, but we do have new folks that join us in our webinars monthly. So we want to introduce you all to Envision. So Envision Equity supports the CDC funded program, CHWs for COVID response and resilient communities, which uses the acronym CCR. And you can find details about the initiative and who the funded organizations are at the chat. So the link will be put in the chat. And then so to learn more about Envision and our staff, you can also click on Envision's landing page link and up into our listserv. And then both of the links are going to be dropped into the chat right now. And on our website, we do have a feedback or comment section that we would love to hear from you all. So if you could also go into our website and also leave us some feedback or comments, that would be great. Next slide, please. So today's objectives, we want to share on how it says they, but you all attendees, how you currently think about community resilience. And if and how you all see the elements of community resilience in the work that you all do, and also be familiar with the definitions of community and individual and community resilience, and then also understand the differences and the connections between individual and community resilience and why CCR focuses on community resilience. And we want you all to also understand that CHWs are well supported and they contribute to building community resilience. So next slide, please. Before we begin our first activity here, I do want to give you all a little quick tutorial on what we are doing next. So we will be using the annotate function on Zoom. So I will repeat this multiple times, but if you on the I think oh, I'm so sorry, the screen looks different now. But in Zoom you will have the annotate. You do have a toolbar that says annotate on there, and if you could go in and click on annotate on the toolbar, and another toolbar will also appear, and there should be an option for you to click on text. And facilitators, can you all see the annotate option on your Zoom bar? Okay. For some reason, I can't see it on mine, but if you all are seeing it, that's great. So we will be using this annotate function for our activity that we're doing here right now. So I'm going to repeat that one more time. I'm sorry, that's very confusing because my screen is different, so I can't see it. But if you go onto the taskbar on Zoom, there should be an option that says annotate. You will click on annotate, and then a second toolbar will appear, and then you will click on text, and then a text box would appear, and then you will be using that text box to type in any words. So that's what we are going to be using for our next activity. So let me go into our activity. So it looks like it's working, which is great. So our next activity, so as most of you know, the title of this project is CHWs for COVID response and resilient communities. But today we are going to focus on the second part of that title, which we are going to talk about community resilience. And we are going to start with that part of discussion now. So my question for all the attendees here is, when you hear the phrase community resilience, what comes to your mind? And so you will be writing what comes to your mind when you hear the phrase community resilience. And then Monique will also be dropping that question down in the chat. And then just for folks, if you all are having issues with the annotate function on Zoom, you could drop it in the chat as well too, because we want to hear from you all. So please, if you are able to use the annotate function, use that. If you can't, put it in the chat. We all really want to hear from you all. So we are going to spend the next 5 minutes doing that. So I'm going to give you all 5 minutes to write down what comes to your mind when you hear the phrase community resilience. And then we will share, and then we will have the next 5 minutes doing a share out as well. Is there anyone who would like to share what they wrote down, or if they saw something that they really liked and wanted to make a comment on it? Because I know Bree did mention, I love the focus on connectedness, and I see it as an emergent theme. Thank you for your comment, Bree. Okay, Sherry, I see.
Sure, I can be brave. Give us a kickoff in conversation. I noticed that I see things of like high value on human life and rebuilding trust and community. Those things both speak to repair to me, that I feel like folks are putting in the chat that part of what resilience is versus just a strong community is that there's something that happened first that now needs to be responded to, adjusted to, grown from. So that's one thing that I notice in some of the words. And I'd really love to hear anybody else's thoughts on what they see in the words.
I can go. This is Morgan Kerhen. I think, Sherry, I definitely hear what you just picked up on, and I probably agree with that, where there feels like because of something that happened before resilience needed to take place, it feels like there's a level of prevention that should occur, right? Like, is there, like, why do we have to be resilient, right? Like something happened to communities in the first place in order to create a sense of resilience and being resilient. So I agree with that, and that's something that came to mind as well.
I can speak. This is Monique Allen with Envision. I also wrote, I loved seeing that the comment on high value on human life, strictly because it just made me think in reading the chat and just thinking, it just makes you pause, to think about others, think about their perspective, not only your own. And that's what I'm getting from this. It's just teaching, us to just pause and really take in what we're hearing from others and not just going through the motions, and just really valuing that human piece. So that's what I'm getting from this.
Thank you, Monique. We have time for one more person if you would like to come off of mute and share.
I'd just like to add just one word. I don't know if I see it up here, but resourceful. When a community comes together, when they're resilient, they tend to be very resourceful. So just would like to add that word to the bunch.
Yes, thank you. Okay, thank you everyone for sharing, and thank you to all the folks trying to navigate the annotation feature on Zoom. I know that was probably that probably took a few minutes. So thank you all for sharing out on what you all think about when you hear the phrase community resilience. So I am going to clear the screen so that way we can move on to our next slide. Okay. With that, it is my pleasure to transition and introduce our first presenter, Selena Freimark. So Selena is a health and well-being educator with the University of Wisconsin-Madison Division of Extension. So she will be presenting on individual resilience. So I will pass the mic over on to you, Selena.
Great, thank you so much for that introduction. Yeah, we're going to talk about individual resilience in the next few minutes. So what does that mean? So let's talk about what hopefully you'll walk away from in our 10 minutes together. So we're going to try to define resilience. We're also going to understand how chronic stress can lead to burnout and compassion fatigue, learn resilience skills and strategies through the Center for Healthy Minds framework, and also see how individual resilience connects to community resilience. Next. So what's resilience? Let's use the term resilience to think about it as a process versus resiliency with a Y, which can be considered more of a characteristic or quality to achieve. So resilience is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. So we can try to think about resilience as a way of flowing with the factors in our lives, kind of like a tree root when there are literal or figurative barriers or obstructions in the way, like in this picture. Or how trees bend and sway in the wind. How can we bend versus break? Well, this is a screenshot from a Minnesota Public Radio article. So in June of 2013, a windstorm blew through Minneapolis and toppled many, many trees. I was living in Minneapolis at the time, and this wasn't too far from where I lived. It looked like a tornado had blown through the area because so many trees were down. And a couple of years ago, I was listening to Minnesota Public Radio, and they were talking about this storm and why so many trees came down. And it turns out many trees went down were near sidewalks. And as the tree roots grew, the sidewalks pushed up and became unleveled. So throughout the years, the sidewalks were repaired by cutting into the roots of the trees to get the sidewalks leveled again, which weakened the tree's structure. And as these trees were more at risk because of the environment they were in, not because they were inherently weak or less resilient trees. So when we talk about resilience being about bending instead of breaking, we really cannot forget how important environment plays a role. We really need to consider things like adverse childhood experiences, or ACEs for short, and social determinants of health, which are non-medical factors that influence health outcomes when we're speaking about resilience. And this is an example of a mental health continuum. It's an older model that was used in mental health first aid trainings, which has since been updated. But I think it helps to illustrate why self-care is really important. However, let's hold these definitions lightly because we know that humans don't fit neatly into boxes. When we think about well-being, it's helpful to resist thinking in good or bad, either or ways. So in this image, what you can see is on the green and yellow parts are where we're talking about self-care and social support. So then the green, quote unquote, normal functioning, we have kind of consistent performance, normal sleep patterns, things are going relatively well. In the reacting stage, that's more common, but also reversible distress, maybe procrastination, maybe some anxiety, increased worrying, maybe some trouble sleeping. And then you go into the orange and the red areas, which is more, right? It's harder to get through our daily needs because maybe we're having really significant trouble getting to sleep. Maybe our worrying is so much that we're just having a really hard time. And then to the red where it's significant distress. And as you can see, the area that is circled, what we want to do is take care of our health when we're in this area before we're in crisis. So what we want to do with self-care and social support, we want to try to take care of these needs when we're in here before we get to the orange into the red area where we do need more support. Because when we're in a fight or flight stress response, it can be more difficult for us to be clear and focused and to know which tools to use and what resources to access, which in turn causes more stress. And in this situation, then the stress can lead to chronic stress. Next. Thank you. So when we're working really hard and yet our efforts don't seem to have an effect, then we may experience what we call burnout. And we probably all know intuitively what burnout feels like: emotional exhaustion, irritability, and a sense of powerlessness. For those in the helping professions especially, burnout occurs in their work to help those facing challenges due to trauma. And caring for others' trauma with an open heart and experiencing our efforts as ineffective can lead to compassion fatigue. And we know we are feeling compassion fatigue when we are no longer experiencing the empathy we feel for the people we care for, that they deserve. Sometimes we might just start feel frustrated or annoyed with others' ways that interfere with working effectively with them. So resilient skill building is a way we can help prevent the cycle. And there are multiple ways to do that. Next, thank you. So one example is using the University of Wisconsin-Madison for Healthy Minds framework. So as you can see, this framework has 4 parts: awareness, connection. Go ahead, I'm sorry. Next, awareness. So what that means is to be more calm and focused by practicing mindfulness and strengthening attention. Lots of ways we can bring in mindfulness and learn mindfulness skills. And to increase that self-awareness is really an important first step. And then we have connection, learning simple skills to build healthy relationships and foster caring interactions with each other. I saw this on the annotate screen, right? When we're talking about connectedness and relationships. The US Surgeon General recently said that loneliness is an epidemic in this country. So think about how connection can fit into our resiliency skill building. And then we have insight. This is increasing the skill of self-inquiry to see our thoughts, emotions, and beliefs shape our experiences. Emotional intelligence is one example of how to do that. That we're kind of questioning, is this the story I'm making up, or is this what's really happening? Kind of pausing before we react and responding instead. So getting that insight to how we are managing our thoughts, and especially during times of stress. And then purpose. Clarify and deepen your personal values and principles to bring in depth to relationships and meaning in your pursuits. This is going to work really well when you're working with partners and stakeholders in the community as well, because often they are motivated by their personal values as well. So do you know what your personal values are? Do we know when we're getting off our path of our personal values? So putting more attention into this can be helpful. A link to this framework and some additional resources are going to be provided later. Okay, next. Great. So individual resilience and community resilience work together. We need to try to move out of this either or mindset into yes and thinking. Self-care and community care. Individual resiliency, community resiliency. One is necessary for the other. I like this quote from the Center for Mind Body Medicine. It says, community care and self-care are interconnected. When we care for our well-being, we can continue to show up for our communities. And when we are in community with one another, finding connection and engaging in mutual support, we are able to tend to one another's needs and create opportunities for each person to tend to their own needs, collectively creating a culture of well-being. So think about how you show up and what impact you have on the community. And think about how important self-care and resilient skill building is for your role as community health workers in helping to create this culture of well-being, creating resilient communities. You are an important connector for community resilience. Well, thank you so much for the work you do, and thank you for your time today.
Thank you, Selena, for your presentation on individual resilience. So next up, I would like to transition into our second presenter. So our second presenter is going to be Andrea Torres Bermudez, who is a senior service fellow, an evaluator at the program service branch is evaluation team of the Division of Cancer Prevention and Control from the Centers for Disease Control and Prevention. So Andrea is actually one of the 3 evaluators on the CCR project. So welcome, Andrea, and I would pass the mic on to you.
Thank you, Munshi, and good afternoon, everyone. I want to start by thanking Envision for inviting me to talk about community resilience from the perspective of the CCR National Evaluation and to represent our community resilience work group. So I want to start by providing some context that's going to be maybe a refresher to some of you who are familiar with the CCR logic model, and I have seen it recently. And then I'm going to share with you the perspective of community resilience that we are using for the CCR national evaluation that is aligned with the CCR NOFO, the Notice of Funding Opportunity, and the logic model, as I said before. I want to just highlight something perhaps very obvious from this slide. And it's starting by why are we talking about community resilience in CCR? It is a key element of the name of the project, as Munshi mentioned at the beginning of the webinar. It is called Community Health Workers for COVID Response in Resilient Communities. This CCR, or 2109, is a 3-year grant that supports the training and deployment of CHWs to contribute to building and strengthening community resilience to fight COVID-19 by addressing health disparities. So that's the reason why it is absolutely relevant and necessary that we talk about it and we make an effort to define it within the scope of this project. Next slide, please. So to continue with the why, I want to talk about where exactly is community resilience in this project, in this program, or in the logic model. So what you're seeing right now is the CCR logic model, and it illustrates the strategies that the recipients are implementing under 3 high-level strategies. As I said before, those are CHW training, deployment, and engagement. As you can see, community resilience is one long-term outcome. It's an expected long-term outcome of the implementation of these strategies. And I want to highlight a couple of things about this. The long-term goal states increase community resilience to respond to future public health emergencies. This implies that the CCR outcome is to contribute to building or establishing a system-level infrastructure that prepares that community to respond to future public health emergencies. I also want to highlight that as a systems level and long-term outcome, it is not feasible to evaluate community resilience in its entirety, and you will see soon how complex this concept is within a short implementation period. We know that CCR is supposed to be a 3-year program, but a lot of you that are 2109 recipients know that that means even a shorter implementation time because it takes time to get to a full implementation stage. However, that does not mean that in the short term or intermediate term, your CCR program is not contributing and maybe significantly to building that community resilience for future response. So the question that brought up to the National Evaluation Group was, how can we measure that contribution? And that's how this work started. Next slide, please. So what I just shared about the systems level perspective, and it's basically the rationale for why we adopted a new definition. What you're seeing now is the traditional definition of community resilience. You might have seen that in many different publications, and it really focuses on the ability of the community to cope with and recover from large-scale emergencies. So the focus is on the ability of the community. And the existing validated tools are based on individual responses, mostly by members of the community, that collect the perceived resilience they think their community has to cope with a given event. In contrast, our definition, you can give me one more click, thank you, or the one that we have adopted for the scope of CCR focuses on actions to build strong community systems and address the many factors that contribute to health. So this is really focusing on the capacity of the communities to provide their members with the resources necessary to become resilient. So if you can see a contrast there, we are basically, and the traditional definition, the burden, if you will, is on the community. Here we are talking about building the system so that community can be resilient. Next slide, please. To get at the definition of community resilience, we conducted a lead review. We tried to identify existing frameworks that have been used to define or evaluate community resilience, or to make it operational. If we were thinking about what does it encompass, what are the elements, what are the domains of community resilience, we needed to understand what those were so that then we can think about how to measure that. There was a systematic review published in 2017 that included over 80 individual studies that had identified different elements of community resilience. And they basically put all that together and came up with a list of the elements or the domains that have been commonly or consistently included in the operationalization of this construct. And these are the 9 elements that you can see here that are consistent with those used that recently published HHS Federal Plan for Equitable Long-Term Recovery and Resilience that was published in 2022. So you can see that these are systems level elements or domains that start with local knowledge, basically everything related to training, education, and to build collective efficacy and empowerment. Health system, which gets at all the delivery and quality of care, which is what in CCR is being done at the deploy level, deployment of CHWs and integration of CHWs into care settings and community settings. Resources, which refers to harnessing and allocating resources. Economic investment is that equitable distribution of financial resources, and the implementation of cost-effective interventions. Governance and leadership, preparedness, which is also extremely important, but actively involving the community in the response planning. Community networks and relationships it has been called in many different ways: social capital, collective efficacy. It's this connectedness and community and social network that many of you listed when on the exercise that we did at the beginning. The clear communication, the creation of common meanings and understandings, and provisions of opportunities for open dialogue. And mental outlook, which refers a little bit to what Selena was sharing before, just a tiny part of all the what she was sharing, that it's more related to the individual level attitudes, feelings, and views about facing uncertainty, which usually can become a social norm. So those are the 9 elements that so far we have been considering. And if you can go to the next slide, we created a work group, community resilience work group, that's formed by the 2110 recipients for this NOFO. These are the Arizona State University and the WASP team, and also the Envision team. And in collaboration with CDC, we have a work group to develop this. Our goal is to develop a conceptual model that can illustrate how CCR contributes to the long-term outcome of increasing community resilience to respond to future public health emergencies, basically by digging deeper into what the 9 elements that I just showed you mean, and how can we describe and operationalize these elements for the scope of CCR, a community-based intervention, a CHW-led community-based intervention with a specific scope and specific outcomes. So at this point, we are kind of going deeper into those elements or domains to make sure that we bring elements of the literature to inform a broader definition that aligns well with our scope and the logic model that I presented. What we are doing next is, once we have some preliminary definitions, we want to share that for input with the 2109 recipients, with CHWs, with anyone who's involved with the NOFO, so that we can see if the extent to which these domains resonate with your work, and also how are you addressing these elements in your work. We want to learn from what you are doing to inform the scope of these definitions and how they connect with each other. And that's really what's going to inform the final conceptual model, hopefully a simple visual that can help people make this very complex concept something easier to grasp and hopefully easier to measure. So the last step is hopefully identifying some proposed indicators in ways in which at the short-term or intermediate term, you could measure that contribution at the systems level of each of these domains in a program in an easy way. So that's basically the work that we are doing. And we this is actually the very first opportunity to learn from you and receive input. And I think we're gonna jump to that next. And stay tuned, because we will be announcing additional opportunities for that input. Thank you very much.
Thank you, Andrea, for your presentation. So like what Andrea mentioned, right now we will be moving into our main activity. So Caitlin, can I have you go to the next slide, please? Thank you. So we will be going into breakout rooms for 30 minutes. So we would like to take this opportunity to have a deeper discussion on what we just heard and what you are experiencing in your communities. So folks will be put into breakout rooms, and there will be a facilitator in each room asking the group questions. So when you first get into the room, you're going to have to do introductions and then choose a note taker and a reporter. So Caitlin, can I have you open up the breakout rooms now? And then after 30 minutes, we'll see you all in a bit. But now we do have 10 minutes reserved. So we would like to give this time for each group to the reporter to come off of mute and share what that one key component that you all learned or you all discussed in your group.
So I facilitated group one. I'll jump in and say, I know that Nellie kind of graciously agreed to report out, but then if anyone else in the group, Florence or Desiree or Jessica, had anything to add, they should please feel free. Do you want to kick us off, Nellie? Are you able to?
Hello, everyone. My name is Nelly Plasencia. I work for Family Health Center in Worcester, Massachusetts. Hey, Daryl, I see you. So I'm going to share a little bit. Let me pull up the other page where I did the notes. So we talk a little bit. I'm just going to write what I could, kind of talk about it to myself. So it was a little hard to write and talk about at the same time. But we would talk a little bit about the community network and individual relationship of elderly and feeling lonely. I don't know if the other ladies are available to explain a little bit more if we want to talk about it. But that was one of the community resilience. The other community resilience was the lack of education to patients while medical visits versus outreach from, in this case, CHWs that can help a patient feel more comfortable in a telehealth or outreach call. That was actually one of the points that I had put out there. And the community resilience about that I have is that I feel that patients are able to get a little bit more education from what the outreach calls, even CCR in this case will be. And I feel that it comes a little bit resilience because they're getting this information from us instead of their medical visits, basically. So there is basically an outreach, a referral being placed, and we are reaching these patients with referrals and things like that. And a lot of them kind of hold back from the information because of the, lack of education that they might get through their visits. The other part was the lack of resource available and also available to patients and also to be able to get them when needed. So that was basically meant of the community does have resources available for everyone, but it also falls into a paper base of what income basically based they might be getting into the household versus if their income is good enough for them to have in a household. And that was also brought in my side because I do believe that a lot of the community resilience has to be with the needs that the patients get out there. Some of the patients, again, we work individually here. So some of the patients out there might get this, might have a resource available, and we might send them as CHWs to get this resource, but also might not qualify for this resource because on paper they make enough money amount for the family household, and when in reality they don't. And I think a lot of us are shaking our head because we know that we have put our patients and even family members probably into this or having ourselves into this situation or position that in paper we are good enough for everything that the community might have out there for us, but in reality is that it's not. And the last one will be also community resilience with teens population, and that was also brought for one of the team that we have here. So if they want to talk a little bit more about it, they're welcome to. And that's all I got.
Thank you, Nelly. So if group 2 would like to go next, can we have you all share that one key point that you talked about or you discussed in your breakout room?
This is Maya, and I was in breakout room 2. And what stood out to us that caught our attention during the presentation was that something significant has to happen to build resilience too. The importance of the partnerships and also relying on our community partners is incredibly important. In our program here at CHA, we try to anticipate the need, and we are currently reaching out to places or communities that we normally don't reach out to, thinking outside the box. You cannot be complacent, and you have to be proactive and have the ability to pivot. For Jacqueline, for her, it meant that a community can bounce back from anything, problems they are facing, navigating resources, etc. She said, how I'm made resilient is by setting a lot of boundaries in my neighborhood. Are we seeing these community resilience / elements from the presentation show up in our work? And for us, for Marion, it's preparedness is not seen as much due to burnout, lack of wanting to, or being able to do forward thinking within the community, governance / leadership. So for Brooke with the health systems, working out of a public health system and having collaborations with providers and help with outside resources, it helps to have that support going in both directions. And for me, all of the pieces are involved in ensuring community resiliency. And we are including our aspects in our work and coming up with ways to include the public in our work in governments, networks, partnerships, and collaborations are open and frequent communication, trickling from the top down, and leadership, including CHWs when able. And that means that we're also at the table. We have CHWs working on mental health as well, so that if we see people out in the community that need access to mental health, we have access to a clinic that we can provide the information to. And that's what we did.
I was just going to share that we discussed, we were group 3, by the way, how a lot of the community resiliency is also including systems level, which was mentioned, and that policies like at that level impact resiliency. That was kind of a lot of our conversation.
Thank you, Jennifer. Tammy, I saw you come off of mute. I think we will have time for you.
Really quickly, I was just going to say 2 big issues that we talked about. One was the difficulty of measuring community resiliency, the complexity of being able to measure that. And then the second thing that we talked about kind of resonates with the first one, or the group 1, is lack of resources, and in particular, lack of housing resources. And we were talking about how there are a lot of referrals that are made, but not many that are completed because of that being a big issue.
Thank you so much. So thank you to everyone for sharing. Andrea, I know that your team, I don't know if you want to be the one to report. Can we hear what your team said?
I was just typing one thing that that I thought it was very important from what Lorena and Carla had to share is that, well, first of all, they share that they think that pretty much every domain from the 9 domains or elements have been implemented in their CCR work. And they highlighted community networks and relationships, not with that name, but the description matches that. It's the integration of the community health centers with other areas of the community-based organizations like YMCA, schools, and that connectedness of all of these community actors that just creates community assets that are extremely important for resilience.
Thank you so much. So thank you to everyone for sharing and leading such great conversations and discussions. So I would like to thank both presenters again, once again, to get for giving out such and also giving a shout out to all my facilitators. Thank you all so much. I can't even express how much I appreciate you all helping me with today's webinar. So thank you all to all the participants for attending our webinar today, and we cannot wait to see you all again next month. Bye, everyone.